Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. I'm Devin Giannetti, and today we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, and Educational Service Center of Northeast Ohio Director of Operations and Development, Jennifer Dodd. As usual, we will begin by hearing from our county and community leaders, and then we will have some time at the end for a few questions. Thank you for joining us today, and with that, I will turn it over to Executive Budish.
Thank you. Good afternoon, everybody. Thank you for joining me and Commissioner Terry Allen and Jennifer Dodd to give you updates on a couple of county initiatives and on the Board of Health. I want to thank Terry Allen and his entire team for continuing to do the life-saving work that they're doing. We're now almost a year, believe it or not, a year into this pandemic, and the efforts of Terry's team to stem the spread of the disease and to keep people healthy and safe, they've just been so important. They're doing everything they can to get us through this pandemic safely. And we have to do our part, continue to follow all the protocols, to wear our masks, to socially distance, to avoid gatherings with anyone outside of your immediate household. If we can keep our numbers in control, it's going to make this next phase of vaccination much more successful. And then we will be able to get out of this more quickly. I know that Terry will be addressing vaccine distribution, but I wanted to give you all just a quick update on the county's efforts in terms of equitable distribution. As I mentioned at the last briefing, there's a huge vaccine shortage, and what there is not getting out to minorities as it should. In fact, the percentage of minorities receiving the vaccination remains way too low. You may remember we saw this same kind of issue with the testing. At that time, I was able to do something about it. The county put $5 million towards 30,000 tests and partnered with Metro Health and the Board of Health to specifically target minorities with our efforts. And it worked. But with the vaccine, we're limited by both supply and by the state's decisions on how the vaccines are to be distributed. The state's controlling how they're being distributed and where they're being distributed. Now, I've spoken with the governor multiple times about this, and I understand his strategy, which is to get as many doses into as many different places as possible so that people don't have to travel far to get inoculated. And we have a map on our website with weekly updates for where vaccines are available near you. You can go to cuyahogacounty.us/vax, V-A-X, and you can see the map. Or you can call 211 if you can't get online. But even with this large distribution area, minorities are still not getting the vaccines that they need. That's why we're working with Hamilton and Franklin counties to put together a formal request to the governor that he allocate at least 20% of the vaccine specifically for minorities. That is the right thing to do. We know that COVID has highlighted terrible inequities in our health system, and we have to fix those issues. We have to acknowledge them, shine a light on them, and then make a change for the better. Just because something's tough doesn't mean that we shouldn't be doing it. Now I'd like to switch topics and talk about our lake. I know it's frozen over right now, but soon, real soon I hope, it'll warm up, the ice will start to melt, the days will get sunnier, and we'll be back to boating and swimming and walking and biking along the lakeshore. Our lake is a true treasure, and I want to update you on our public access plan. We have 30 miles of shoreline here in Cuyahoga County. Some of it's very accessible to the public, but much of it is privately owned, and public access is limited. There's really been no overarching vision for the lakefront either. My vision is that we make all 30 miles of lakefront accessible and interconnected so that people can bike or walk along the lake from one end of the county to the other. Now, I know that's ambitious, and it's going to take a while, but this is an investment in our future as a county. If we do this right, we'll have supported and beautified our most valuable asset, our lake. This can be done. Just look at Euclid. The county partnered with Euclid, the state, and others to create and enhance public access, even though much of the property was privately owned. The property owners in that stretch of lakefront agreed to allow public access in exchange for protecting their properties from erosion. And that's the model that can work across the lakefront. With the County Planning Commission and our consultant, the Smith Group, we've had 3 separate public meetings with lakefront property owners to explain to them the benefits of this approach. We know that many are struggling with erosion. They're concerned. We were pleased with the input and feedback we got from many of the property owners, and we're now working on identifying shovel-ready projects, especially in severely eroding areas which are in need of emergency stabilization. The property owners don't want to wake up one morning floating in the lake. These projects will be expensive. What we are doing right now is twofold: identifying priority areas and working to shore up funding, from the state and from the federal government. I'll continue to keep you all informed as we continue to provide more public access to our lake. Now let me switch to another update on another important project, and that's the microgrid. We've been working with the city of Cleveland to establish a microgrid that's in the city. As we continue to work on this, it occurred to me that maybe we could take the same concept and launch it in other areas around the county. Remember that the concept is a secondary power source that can generate electricity, heating and cooling, distribute energy, and manage energy consumption, all while separated from the larger energy grid. We've seen just how incredibly important a strong and reliable local grid is. Just look at the terrible and dangerous blackouts across Texas right now. The goal of a microgrid is to provide highly resilient power to businesses and commercial entities that need it. What do I mean by resilient? I mean power that has an uptime of 99.999%. That's 5 nines. That's how it's looked at. In other words, it's reliable power that you can count on. We'll be able to guarantee that even if the main power grid goes down, those on the microgrid won't lose power for more than 5 minutes in a year. It's incredible. Just imagine, we can offer businesses the most reliable electric power in the world. The microgrids will also provide clean and affordable electricity. How will we do this? We're proposing legislation next week to County Council that'll give the county the ability to create a power company. We have the legal authority to operate a municipal utility. Now, I know some of you might be thinking that this sounds like a really bad idea. What does the county know about running an energy company? But let me explain how it'll work. Our Public Works Department will release RFPs to seek bids from developer operators and investors who can come in and build out the system under the auspices of the county. It's the developer operators who will construct the generation and distribution facilities and who will then sell energy to individual commercial customers in specific geographic regions. In other words, they'll run it. We've been in discussions with local municipalities and already have some potential first projects in mind. These are places where we have had interest from community leaders, local governments, and businesses. So we're looking at places like the Arizona over by NASA, the old Brooklyn American Greeting site and surrounding area, and the Sherwin-Williams Brecksville site. Again, this is early stage, but this is just to give you an idea of first potential projects. This is a bold and important direction that we're taking. It's about business attraction and innovation and clean energy. This will put us on track for our economy to come roaring out of the pandemic. That's what's so exciting. The bill that we're presenting in committee next week is co-sponsored by Council Members Simon, Miller, Conwell, and Sweeney. I'd like to thank them all for their support and enthusiasm around this initiative. And now I'll turn it over to Terry Allen. Thank you.
Thank you very much, Executive Budish. We appreciate, as always, your partnership from the beginning. We've been doing this for quite some time through the thick and thin of this response, and your all of the social service departments that you oversee, all of the emergency operations staff, and that have all been wonderful. The public works folks have helped us in innumerable ways from the beginning of the pandemic. So I want to thank you for all you've done to move us forward through the pandemic. I'm going to, at this point, introduce someone who, I guess, will follow me then in the response is Jen Dodd. So you see Jen Dodd there. Jen Dodd is from the Educational Service Center, as you heard introduced at the beginning by Devin. Dr. Dodd has been working with us since the spring on weekly conference calls with all the superintendents in the county. And so we've been doing this really since graduation, talking with them around the challenges in school systems through the roller coaster ride of cases of closures and reopenings and remote, hybrid, and full face-to-face activity through all of it. And I wanted to first thank her and all the work that her boss, Bob, has done with us in the process, and all the superintendents who have put their heart and souls into this response. And we appreciate your partnership, Dr. Dodd. And with that, I wanted to you've got some great news on some progress that you've made with superintendents and those at risk in schools, the adults. And I think the folks listening be happy to hear about what you have to say. It's great news.
Sure. Yeah, we've been busy. We've been excited. But Terry, thank you to you and your entire team for always being on those calls. There are so many things that the superintendents have had to try to decide or change or revise multiple times. And so having your guidance and the information that you guys have been provided has been really, really helpful. So it's really been a godsend. So throughout this whole entire year, we've been busy, as Terry has said, on a lot of different aspects, how COVID impacts schools. But the most exciting news right now is about the vaccines that have been provided to educators. So you've probably heard from the rollout from the governor's office that they're working through the ESCs to get to different school districts. Each week are different counties. So Cuyahoga County started last week. Week 2 is when we were in. And we were really excited that the governor was leaning on the ESCs. We already have the relationships with school districts. We have all those contacts, and that saves a lot of time and energy. And they also turn to us for those questions and answers. So I think it was a really good partnership. So each county and some different districts are using different providers. We, for our clinic here at the ESC, have been working with Giant Eagle, and they have been phenomenal. Working on the logistics, we ended up doing a clinic here at the Educational Service Center. Some other counties have done them across different districts. And so logistically, we set up for 12 days for dose 1 and 12 days for dose 2. We started this first dose on February 10th. We're going to go until February 24th. And then we'll have about a week off, and we'll pick up again on March 3rd and go through St. Patrick's Day. So basically, when we're done with all this, it'll be spring is what we're working towards. We're working with 250 different school entities. So most of the public school districts in Cuyahoga County and a lot of the non-public schools, the community schools, some of them also went with Cleveland Municipal Schools partnership with the Cleveland Department of Health. Those that were in the city of Cleveland actually had a choice to go with Cleveland's program or ours. So we've got about 250 entities. We're scheduling them throughout the 12 days. That totals about 23,000 educators that we're going to be able to get through in this round. Like I said, dose 1 ends on February 24th, and we'll pick it up again on March 3rd for dose 2.
Well, thank you very much, Jen. It's impressive with the location being able to move people through, at the pace that you have, so that you can meet that, toward the goal toward March 1 to get kids back into school. So thank you very much for sharing that information. And,
you're welcome.
Hard work together all these many months. So.
We're excited. Our building has been empty for about a year from all our professional development being virtual. So it was the perfect space. Been sitting here waiting for something like this critical to do. So we're excited to help.
Thank you very much. And I'm sure there'll be questions when I wrap up here. So stick around.
I will. Thanks.
So first of all, I want to say I'm happy to report that COVID-19 cases continue to drop in our community. And clearly the masking, the distancing, the remote work, avoiding large gatherings, case investigation, contact tracing, suppression of disease clusters, and vaccination have all played a part in this great news. These tools are the way out of this pandemic. Our vigilance is clearly paying off. And amid this promising news, we need to remember that Cuyahoga County is still 2.5 times the CDC threshold for high transmission and remains at level 3 or red in the Ohio Public Health Advisory System, indicating a high risk for transmission. We have to hold the line to assure we continue moving in the right direction. This threat remains ever present, particularly as variant strains emerge in the US and with the very transmissible UK variant appearing here in Ohio. Those infected with COVID-19 need to isolate themselves to protect their friends and loved ones, as they've done from the beginning of this pandemic. And those exposed to someone infected should continue to quarantine according to public health guidance. In support of the progress we've made in slowing the spread of the COVID-19 transmission, it's important to stay vigilant and play both defense, wearing masks, distancing, hand washing, and avoiding large gatherings, and offense as we increase the number of those vaccinated against COVID-19. Across Ohio, over 11.7%, about 1,369,000 Ohioans have been vaccinated here so far. We see similar rates, about 11.1% here in Cuyahoga County, with about 136,800 people that have started vaccination. The Cuyahoga County Board of Health is working alongside the other 80 providers. There are 80 providers that are offering vaccine in the community and to vaccinate a range of populations. They're mostly focusing on 1B, and we'll talk more about what that is. So we want to assure, of course, to work together toward increasing equitable access to vaccines, as Executive Budish noted. We're also committed to continue to provide educational information in our community, along with public health working with social service medical partners, providing the tools for folks to have the information they need when they make the decision that vaccine is right for them. And we want to make sure that people are comfortable when they decide to come forward to be vaccinated, and they receive information from people that they trust. We know these vaccines are safe and effective. They keep people healthy and they save lives. We've worked with radio and media outlets and our Cuyahoga County administration to develop videos from trusted medical professionals on our Board of Health, including Dr. Greg Hall, our board president, and Dr. Sherry Williams, and others, to share the importance of vaccination in our communities of color. You can check out our YouTube videos and our YouTube channel to see these videos. As part of Ohio's continuing efforts to ensure equity in Ohio's vaccination program, the Ohio Department of Health is holding virtual town hall meetings focused on specific minority communities. These virtual meetings will involve local medical professionals and community leaders who will guide these conversations to discuss the safety and efficacy of the COVID-19 vaccine. The meetings are intended to jumpstart conversations and give local leaders and attendees the tools they need to better inform members of their communities about vaccine facts, enhance access to trusted resources, and drive conversations in their own communities about why vaccinations are important. The town halls will be streamed on Facebook and YouTube, and more details about these town halls are available at coronavirus.ohio.gov/townhall. I'll repeat that again, coronavirus.ohio.gov/townhall. So I'm also happy to report that by Sunday evening, we'll have provided 16,660 vaccinations to approximately 10,200 people, using over 75% of our first dose supply. We'll be working with the Ohio National Guard and other partners in the future to provide vaccination at senior housing and vulnerable communities to support the goal of equitable access to vaccine. As we've reported, the Cuyahoga County Board of Health has almost completed all the first doses for our Phase 1A group, which is of course based on eligibility, including patient-facing healthcare workers not connected to hospitals, EMS, and developmentally disabled populations living in group homes, which is the portion of our focus for 1A. And right now, health departments are the only providers for 1A vaccine in the state. According to the Cuyahoga County Board of Developmental Disabilities, there are over 480 facilities serving the developmentally disabled across Cuyahoga County. And we've greatly appreciated our collaboration with the DD board in this vaccination campaign. And today we're actually working together with them to provide vaccinations for groups of developmentally disabled individuals at a clinic, since those individuals are quite at high risk for COVID transmission. Additionally, our medical director, Dr. Heidi Gullett, continues to lead a mobile team of doctors to vaccinate those living in adult group homes that can't come to our clinics. She's also working to do vaccinations in recovery houses and other congregate settings to reach folks who need access to the vaccine. And that's an ongoing effort and requires a lot of detailed planning and moving around the community to address smaller groups of individuals. We'll also be delivering second doses of vaccine to a range of assisted living facilities that do not have pharmacy partners and be returning to those sites, and that'll be happening next week as well. So consequently, in the near term, we'll continue to see some overlap between phase 1A, even as we begin to move more in earnest into 1B. As you know, the Ohio Department of Health has posted information on all the providers in Cuyahoga County that are dispensing vaccine in phase 1B on the Ohio Vaccination campaign. The list includes federally qualified health centers, home health providers, hospitals, and select pharmacies. Given the governor's recent positive news about the potential for increased vaccine allocations in the coming weeks and months, we're glad that more seniors and other eligible individuals will have access to this life-saving vaccine. I wanted to take a moment to review the new medical conditions that are now eligible for vaccination under 1B in Ohio, and ask that Jonathan put up the slide so that we can walk through these conditions. So this slide indicates a range of conditions that are now eligible. And these are conditions that are either those who are born with these conditions or are developed in childhood. These are severe conditions that put them at very high risk for dying from COVID-19, which is why they've been prioritized by the state. So we want to walk through, and you can see some of these conditions: sickle cell anemia, Down syndrome, cystic fibrosis, muscular dystrophy, cerebral palsy, spina bifida, people born with severe heart defects that require regular specialized medical care, people who are hospitalized with type 1 diabetes, who've been hospitalized in the past year, a range of other genetic disorders. And it's important that people review this list, and they can check in with their doctor if they have questions specifically about qualification. We encourage individuals who may be eligible to connect with their doctor if they have questions specifically about any of these conditions. Again, we think that's critical. The state's also encouraging hospitals to proactively reach out to patients hospitalized in the past year for qualifying conditions to schedule these patients for vaccination when available. And these patients, of course, can choose from the range of providers to access the vaccine. If an individual who's been hospitalized in the past year for a qualifying condition chooses to get vaccinated, that person will be asked to confirm that they have one of the conditions listed, but do not need to name the specific condition. The state of Ohio is not requiring any additional documentation or proof of eligibility. Providers will confirm with the patient that they have one of the qualifying conditions verbally or on a screening or registration form. Thank you, Jonathan. Moving on, I wanted to provide a reminder that there are 80 locations in the county that are currently providing vaccines. The Board of Health posted a text version of the list of providers on our homepage that offers a localized view of these providers and how to reach them. And this list can also be found at cuyahogacounty.us/vax. That's cuyahogacounty.us/vax. County Executive Budish and County Council have funded 15 operators, as Executive Budish mentioned, at 211 First Call for Help. Dial 211. It's a great resource, and they can help you get access to vaccine as it's available in the community. And meanwhile, we continue to work with the County Department of Senior and Adult Services, Community senior centers, the Western Reserve Area Agency on Aging, the Cuyahoga County Library System, and others to best reach our senior populations for vaccination. We know the demand for vaccination clearly outweighs the current supply, and we're urging continued patience as providers work to vaccinate eligible individuals in the coming weeks. All those who are eligible and wish to be vaccinated in phase 1B, need to directly contact these providers to schedule a vaccine. Phone numbers and web links are available to call these providers to schedule a vaccination. If you've already pre-registered for phase 1B at www.ccbh.net/vax, that's www.ccbh.net/vax, we recommend that you contact these providers, or you can wait for a slot to come up at a CCBH vaccination clinic. I have a few important reminders for those that are working in our system and are involved in our vaccination clinics. For those scheduled to receive their second dose at our vaccination clinics, I want to make sure I remind you that you need to be sure to follow the reminders we provide and have your registration form filled out in advance of coming to the clinic, and bring your vaccination card that you got in your first dose. So have your registration form filled out and bring the vaccination card that you got in your first dose. This will ensure that we move folks smoothly through the drive-through clinics or other clinics that we have in place. The date on the back of your card is not your scheduled date to get your second vaccination. It's a reminder for your calendar about the approximate date of your second vaccination. The actual date may vary slightly from the date on the back of your card. We provide information on how to book your second dose at the time you get your first dose. If you pre-registered with us but received your first dose from a different vaccine provider, we would like you to remove your name from our list, as you'll get your second dose from that same provider. You can help us by emailing us to let us know. This will allow us to open up a spot for someone else. Please email us at COVID/19 -unsubscribe@cuyahogacounty.us. I need to fix something because I misspoke just a moment ago. I'm going to repeat this twice. COVID-19 -unsubscribe@cuyahogacounty.us. COVID-19 -unsubscribe@cuyahogacounty.us. I wanted to take a moment before we transition to the FE brief to recognize that there has been a tremendous amount of heartbreak suffered by so many through the tragic fatalities that have occurred during this pandemic. To date, 1,656 of our own county residents, 16,600 total Ohioans, and over 493,000 Americans have died from COVID-19 since the beginning of the pandemic. So many others have been hospitalized from complications during the pandemic. And I want to recognize the horrible toll that the virus has taken on our country, on our state, and our community, and on the world. Many other tragedies have also taken place, and countless others are in the painful grip of anxiety, grief, and incalculable loss. Their friends, their family members, neighbors, co-workers. We need to reach out to them to support them during this very difficult time. Even in the face of these difficulties, there have been hopeful moments that remind us all that spring is coming. Just yesterday, we witnessed yet another marvel of science as the latest NASA rover landed on the surface of Mars after completing a 300 million mile journey. The impressive and flawless entry into the Mars atmosphere and landing was witnessed live the world over. The rover was aptly named Perseverance, emblematic of the determination that everyone has shown during this long and difficult pandemic. So remember, spring is coming, and it's getting better slowly every day. So we'd like to transition now to our weekly EPI brief that we provide. Thank you, Jonathan. So we'll start off at the top and we'll look at our cases. You see our case numbers. We have our case numbers, of course, looking at 65,702 cases and 3,820 hospitalizations, 755 ICU admissions, In our jurisdiction, we've had 1,335 fatalities countywide. It's 1,845 currently across the entire county. Our new case reports are down, and that's what we've talked about, and that's important. We've had a slight increase in fatalities, 48 the previous week, 59 reported this week, and mostly those are part of the lag from the adjustments at the State Health Department on fatalities. If we move down the page, you'll see in terms of looking at our cases, this past week, we're happy to report in our jurisdiction, we've had an average of 183 cases per day, down from 234 cases per day in the previous week. And remember also from with the fatalities above, that our deaths are also way down, of course, from that tragic time in December when we had so many people dying, particularly in our nursing homes. And the vaccination program that we heard about across the state that will continue within the nursing homes of both workers and residents will also help to further reduce the risk of those fatalities, and that's a wonderful thing. So you'll see that about 45% are male and 55% are female, and we have a range of distribution across cases, with the highest ones being those aged 20 to 29, and then we have a range really looking at from 20 all the way through 69 that encompasses the largest majority of cases, with the fatalities occurring among our oldest residents. If we look down the page and we look at some of our race and ethnicity data, we'll see that 58% are white, 22% are African American, still 11% are unknown and not reported, which is important. 6% are other races and 2% are Asian. If we look at our ethnicity data, our data shows that 3% of these cases are Hispanic Latino, 74% are non-Hispanic Latino, and we still have a large proportion, too large a proportion of unknown data relative to ethnicity. We know that we still see that African Americans are 1.4 times more likely to be diagnosed with COVID and 2.6 times more likely to be hospitalized. That's a disparity that we've seen from the beginning of this pandemic. We are seeing bright spots among healthcare workers. Our hospitals certainly have reported that a lot less healthcare workers are being diagnosed with COVID. That affects their ability to take care of patients, and it's important that we protect our healthcare workers. And about 26% of those cases have pre-existing conditions, chronic diseases and the like. Moving on our epi curve, this is a pretty dramatic picture you have here. Going back to the beginning of the pandemic, if we go back to way back in March of last year, as Executive Budish noted, we're really going on a year of dealing with this pandemic. And you saw the peaks in the summer that occurred during our surge. We had then the masking mandate that caused cases to drop off, clear demonstration that our masks work. Then we began to climb this mountain as we moved into the fall. And we saw huge surges through our winter months, and we all lived through those very, very high case numbers. And many points there, we were 10 times the CDC rate of high transmission, and a tremendous amount of work with, at any given time, we could have 100 people calling cases on a daily basis, trying to keep up with the case volume. Thankfully, we're seeing these case numbers drop, and we believe certainly when the vaccination campaign began some 8 weeks ago, that's had a huge impact on this, as well as people getting very good at masking and distancing and staying home when they're sick, and promotion of remote work and avoiding large gatherings. What we have to watch now are these variant strains we said that are emerging. We're very concerned about that, and so these numbers are very promising. Keep doing what we're doing. Moving down to our zip code map, it's remained stable in terms of distribution of cases, and of course, we continue to see case numbers slow, and that of course is a blessing for all of us. This data shows data, as you know, for zip codes across the entire county in collaboration with the Cleveland Department of Public Health. Moving on to our hospital utilization data, we're starting to see a bit of some drops here. You'll see we're at 78% of our critical care beds listed there, and 73% of our adult medical beds. We're seeing slight downturns. We hear the hospitals reporting that they're still busy, but they're busier now with non-COVID related medical concerns, perhaps some that have been delayed because of the pandemic. Seeing a slight increase there in the pediatric medical beds, and our ICU, the ventilator use is pretty flat from the previous week. Again, We do feel that things are getting better. There are COVID patients in the hospital system, certainly, but that the numbers continue to improve and other medical conditions are being addressed in the hospital systems that are using their bed capacity. We have some very good news coming down the page here to look at our hospital testing and our nursing home testing, which continue to drop. So you'll see if we go back to our peak back in December, we were seeing 44,000 tests and our positivity rate was soaring. Here we are now if we look at the past 4 weeks on these data reports, it's important to think about trends. We're always looking at trends and not from a day-to-day or really from a week-to-week, but over multiple weeks. It gives us a sense of the trajectory of the pandemic. So we've gone in just 4 weeks from 13.2% positivity to now at 7.1%. This is great news. It means that people out there walking around, less percentage of them that are tested are positive. It reduces risk for transmission. We have accordingly seen a reduction in the number of tests that are occurring across the entire community. If we go back to its peak, we saw about 44,000 tests being performed a week, and we're down now to just 22,517 tests. So we'll need to watch that, but I think people are turning their attention to vaccination, but testing is there as a resource and it's necessary. We're also seeing nursing home testing down from 15% the previous week to 13%. I should say nursing home positivity for testing. So that's good news. Moving on to the new page that our Director Rush showed last week. We have our vaccine started, and these are numbers. It's about 136,000 today, but looking at our weeks as we do, staying on stable weeks, you'll see we're at about 10% of the population started and 4% completed in the county. That 4% is our second dose. And then you'll see the range of activity as we've seen increases in vaccination, of course, between February 2nd and the week of February 13th through that week. As we mentioned earlier, we know that we're moving out of 1A, where we've done eligibility-based vaccination for our healthcare workers, EMS, and developmentally disabled. We are now in Cuyahoga County at the Board of Health, joining our other 80 providers to be more in earnest moving into vaccinating our seniors. And we're doing that with an eye on equity as we move forward. We've been in discussions with faith communities and a range of partners in the communities I've described earlier. We've certainly been having these partnerships in place since we began our testing campaign, providing support for those that are in quarantine and isolation. And so we're going to continue to move forward to assure that we do better to provide equitable access across the community as we're moving more in earnest into phase 1B, and have a range of strategies using data that will help us identify where gaps are relative to providers, what the vaccination rates look like, access to vehicles, understand race data as well as income data to understand those gaps. And we'll be collaborating with our hospitals and community health centers going forward to track the course of the pandemic and help to reduce risk across these populations. So with that, I'd like to wrap up and hand things back to Devin for our question and answer. Thanks for listening.
Thank you all for your remarks. We now have some time for some questions. Remember to identify yourselves and your organization, and when not asking a question, please make sure you remain muted. And with that, we can start with the first question.
Hi, this is Anna with IdeaStream. Oh, go ahead.
Okay, hi, it's Melissa Reed with Fox 8 in Cleveland, obviously. My question is actually just about, we're hearing that the shipment of vaccines may be delayed. Do you know, this question is for Terry, how long they will be delayed, and how does this affect the vaccine clinics?
Thank you for your question very much. Yes, we've heard that, and it's been widely reported that Governor State, we've had a little bit of snow out there the last few days, and that's affected certainly shipments across Ohio. So what this means is we're going to move forward with our clinics. We'll just use a larger proportion and get right up against our allotted doses. We do also have some second dose allocations we can dig in as we go forward, but we'll be fine because we do expect not only 2,000 to 3,000 doses will be shipped next week. We're also going to be getting the scheduled shipment, so we'll get a double shipment that will, the expected one next week and this catch-up one, which will allow us to continue without interruption for our vaccination clinics, and we're glad about that.
All right, Anna, you can go ahead and ask your question if you'd like.
Thank you. Thanks. So I have a couple questions. Just first, Terry, if you could clarify the status of the county's vaccination effort. So it sounds like you're still finishing up phase 1A and then we'll be moving to 1B and finishing up second doses, or have you moved into 1B as well?
So yes, thank you for your question, Anna. We have, we're just in the hundreds now of our first dose 1A, which is down from a list of 20,000 working through clinics. And so we're very proud of that process. And we have done a bit into 1B in certain instances, but not in earnest. So this is really a transition point for us starting next week. We've got a big second dose vaccination clinic on Sunday. And as I mentioned, we're doing some DD board 1A vaccinations today. But starting next week, we're going to be looking first at deeply at those 80 and above to start there on our pre-registration list and work our way through. And we'll be doing that going forward at all of our clinics. So we'll see as we finish up the 1A first dose, you'll start to see basically our concentration of 1A second dose and 1B first dose as we move through the age cascade as well as the qualifying conditions along with our other partners in the community.
Okay, got it. Thank you. I just wanted to make sure I heard that right. And then
Sure.
The next question would just be, we're hearing from so many people who are having issues, navigating vaccine appointments with different pharmacies, not getting appointments in one place, calling around, you've heard it too. I'm just wondering what your general advice, what's your best piece of advice for people who are navigating this right now? What would you say to them?
Right. Well, first I would say I think that the patience is truly a virtue in the moment. We do still have scarce vaccine. That's a reality, not just for Ohio, but the entire country and frankly, the globe. This is just the world we're in. We will see more coming. We know it's coming. We heard the federal government commit to buy 200 million more doses of Moderna and Pfizer to make sure that every American will have access to vaccine. So it's getting better. What we have is a distribution network. We have the infrastructure so that vaccine is available. And I think it's been reported that it is within 72% of us are within a mile of a provider in this county. That's good news. It's available to many people around the corner. And so we want to make sure that that access is available. So we ask people to continue to be patient, to remember that they can get help as they check back with 211, and that we expect that vaccine availability is only going to increase. And that's a good thing. So we just have to hang in there a little bit longer. We do have a very, very large waiting list that we've been accumulating individuals on since the beginning. And so we're working our way through the wait list. We're also having an eye toward equity, which involves other sort of mobile-based activities that we're incorporating into our overall strategy. So I think patience still, I think, at this stage, but I do expect things to improve in the coming weeks.
And if I can just
So in the
add,
meantime, just continue what they're doing with, checking the different places and things like that.
I would defer, Executive.
I was just going to add, that's one of the reasons we set up the 211 line and added a lot of staff to it because people were running into the exact problems that you've described. It's very frustrating to have to call, 50 different pharmacies and find out, do you have any vaccine? Do you have any eligibility, any dates open? So I suggest people try the 211 number and also our website. If you have access to the internet, I would go to the cuyahogacounty.us/vax, VAX. That can also be helpful.
Okay, thank you. If I can still keep going, I guess. Do you know the status of the school districts in the county returning by March 1st? Do we expect that most of them will be in person and kind of following the governor's wishes?
We're collecting data on that now. for ODE and the governor, so I don't have an answer right now, but hopefully we'll find out soon.
Okay, thank you.
And then maybe time for one more question. Okay, well, if that's it, thank you both very much for your questions. Really appreciate it. That concludes today's briefing. Thank you very much for joining us today and have a great weekend. Take care.
Thank you.
I thank you.
Thank you.
That most of them will be in person and kind of following the governor's wishes.
We're collecting data on that now for ODE and the governor, so I don't have an answer right now, but hopefully we'll find out soon.
Okay, thank you.
And then maybe time for one more question. Okay, well, if that's it, thank you both very much for your questions. Really appreciate it. That concludes today's briefing. Thank you very much for joining us today and have a great weekend. Take care.
Thank you.
I thank you.
Thank you.
That most of them will be in person and kind of following the governor's wishes.
We're collecting data on that now for ODE and the governor, so I don't have an answer right now, but hopefully we'll find out soon.
Okay, thank you.
And then maybe time for one more question. Okay, well, if that's it, thank you both very much for your questions. Really appreciate it. That concludes today's briefing. Thank you very much for joining us today and have a great weekend. Take care.
Thank you.
I thank you.
Thank you.
That most of them will be in person and kind of following the governor's wishes.
We're collecting data on that now for ODE and the governor, so I don't have an answer right now, but hopefully we'll find out soon.
Okay, thank you.
And then maybe time for one more question. Okay, well, if that's it, thank you both very much for your questions. Really appreciate it. That concludes today's briefing. Thank you very much for joining us today and have a great weekend. Take care.
Thank you.
I thank you.
Thank you.